Artur, hi, and thank you so much for joining me on Faces of Digital Health for a discussion around healthcare trends. You're a well-known journalist covering digital health in Europe, so I'm sure we're going to have plenty to talk about around the EU AI Act, around the development in Europe. But since it's summer and since you often write reviews or kind of what stuck with you when you read new published books in digital health, tell me, what are your top three? What are some of the key insights that you read in the books lately?
Well, first of all, thank you, Tiasa, for having me on your podcast. I've been following you for years. So also as a journalist in healthcare, in digital health, you are giving me so many insights and so many inspirations. And I'm really glad that you do that podcast and you reach some people that maybe are not familiar with digital health. So you are doing a great job. But now let's go to the first question. Yeah, you are right. Finally summer and finally a little bit more time for reading and for all the books that been laying on the shelves for months. The first one I would recommend and is the book that I finished reading basically a week ago, which is, of course, The Singularity is Nearer by Ray Kurzweil. Kurzweil is an American computer scientist and engineer who became famous with his book, The Singularity is Near, published in 2005, if I'm not wrong. Yeah, and in 2005, Kurzweil predicted that around 2030, we will reach so-called singularity. It's a state in which the development of technology is so fast that humans are unable to control it or follow it. This is the book that I've been reading recently. The Singularity is Nearer is a kind of update of these visions that Kurzweil predicted in 2005. Kurzweil outlines very bold visions for the development of new technologies, such as autonomous cars, supercomputers, or advances in clean energy. For me, of course, the chapter on healthcare was the most interesting one. When talking about healthcare and medicine, Kurzweil is focusing on three trends or three things. The first one is the use of AI, of course, to predict 3D models of protein structures and the development of new drugs. So Kurzweil writes, for example, about AlphaFold. It's a Google DeepMind project that aims to accelerate research or even unlock the mysteries of how life itself works. While in this case, his predictions seem quite realistic and I really liked it. Further on, Kurzweil highlights some kind of controversial technologies about which I have my doubts. So it's still very interesting and very insightful book, but in some parts, I think he lost himself in predicting future that is probably unrealistic. So, for example, he claims that in 2040 or 2050, latest 2060, we will be already able to copy our brains and consciousness to the cloud so we can live forever in the cloud. Well, this is the first prediction. The second prediction are visions of nanorobots in medicine. He envisions that millions of miniaturized robots infused into the human body, into the human blood, will repair our cells and kill viruses and bacteria, potentially making people immortal. Yeah. So I read recently an interesting article on Wired, and they sum up the book of Ray Kurzweil very shortly. Ray Kurzweil rejects death, and it's really straight to the point. So in my opinion, this is more science fiction than science for now, but nevertheless, it's a fascinating book and I really recommend it.
Speaking of predictions, if you just stay with this one for another second. So you also have keynotes where you give presentations around your observations on healthcare. And I find it quite interesting where you that you mentioned basically the overhyped expectations related to the progress that we can see in healthcare. So from that perspective, what are some of the other thoughts that you hear in the industry in terms of the potential that potentially seems a bit unrealistic to you based on your insights?
Yeah, as you said, there is a lot of hype around new technologies. We have AI, generative AI, that is quite new. Everybody is talking about generative AI. AI is everywhere at once. So, of course, at this stage, everybody hopes AI is this medicine for healthcare system that is not working very well. And I also have my high hopes regarding AI. But slowly we're realizing what we can do with AI. And AI is not a silver bullet for everything that is not working in healthcare. There are a few things like, for example, doctors are overburdened with all the bureaucracy of all the paperwork, typing in the patient records into the computers. So in this area, AI can be a big help, but in other areas, I think that is still overhyped. Of course, I make also my predictions because people are very interested in predictions. They want to know what will happen next. They want to be ready for what will happen next. But I try to be quite down to earth, not to overpromise. We are still in healthcare, so we shouldn't overpromise that, for example, in 5 years, AI will accelerate the development of medicines, because we are giving hope to patients that are waiting for these medicines. So let's be realistic. Let's, of course, make big visions, because these big visions are made for that, to motivate people to make progress.
Yeah, the association that I had when you were talking about the expectations and managing them was the quote from one of the interviews that you did with Professor Barbara Preysak, the head of research platform governance of digital practices from the University of Vienna in Austria, where you guys talked about the use of data and data solidarity. And she said that societies that chase profit and economic growth will always reward irresponsible data use. So what do you think about that in light of all the discussions that we have around GDPR, around AI, around the European health data space, where we emphasize that we want to use data for good, but you have a lot of people in the industry that are basically warning that profit is going to be the primary priority?
Yeah, that's a good question. Well, I'm neither an expert on ethics nor a lawyer, but I will try to answer. First of all, I'm quite happy that the discussions continue despite the huge disagreements on how we use data in healthcare. From my perspective, the use of data is very strongly linked to democratic values. And that is why this discussion will have no end, probably. So we need to find a compromise. It's very difficult to have global consensus because every country has a different approach to data, which is influenced by its culture or trust in the government and so on. Of course, we have in Europe our approach to data that is very trustful, ethical data ecosystems. So let's stick to the Europe, and I really value Professor Barbara Preisnak's contribution to the work on ethical use of data, and I agree with her words that you mentioned, that societies that chase profit and economic growth will always reward. The problem is that's the system we have. So now it's a matter of matching regulation to the system. Yeah, I think there is a broad agreement already on the primary use of data. The data are assets of every patient. And of course, this raises a lot of questions, such as, since data are owned by the patient, does we have the right, for example, to sell it? Yeah, for example, for scientific purposes? Probably not. I had this discussion with Professor Presnak recently, and she told me, well, it would be somewhat similar to organ trade and could encourage, for example, unethical behavior. So this is one aspect. And another aspect of data use is the secondary use of data. Yeah, I guess that almost everybody will agree that anonymized data should be used for scientific purposes in some way, like, for example, to develop new drugs. But what counts as such data? Just health parameters, just data that we are gathering, for example, all the wearables data that is gathered in the doctor office, or maybe also behavioral and lifestyle data. Yeah. So you mentioned also the European Health Data Space, and the European Health Data Space EHDS is a kind of optimistic sign that there is a European consensus on how to share data and how to use data. When you ask me about data and how to use it, when to use it, and should we use it for profit or not, I share a kind of Finnish approach, which I heard at one of the conferences I attended. The health system has a responsibility to protect our health, but also we as citizens, we also have kind of responsibility to create a strong health system by sharing our data. So it's kind of solidarity approach, which is, from my perspective, very fair. So sharing data is caring. We will have this discussion, about buying data, about selling data. We are at the early stage of digitalization and the access to data. It's the first time in the history that we have access to data. We can use data. So now we will have to work out the way that we use it in an ethical way and in accordance to values that are common here in Europe.
Mm-hmm. I think that there's a lot already happening with data gathering and data analysis in the US, much less in Europe. And I think in the public eye, it's often underestimated how far data use still is because of different standards, because of lack of interoperability. So the actual usability of healthcare data is actually not there yet. We like to talk a lot about the potential of data analytics, but a lot of data just sits where it is. So what are some of the solutions that you saw maybe in this kind of data field that you found most inspiring? Are there any use cases that you saw in Europe? I know that you also visited the ARC in Israel, and Israel is a front runner in AI development. So I'm sure anything in Europe that kind of caught your eye?
I've been following some examples of data use in hospitals, like using simple AI algorithms, for example, to monitor patients' health, staying at the hospital, or just orchestrating the patient journey within the hospital. And I think this is an example where we can really improve the quality of healthcare when the patient is staying at the hospital. We are sometimes talking about these high-tech solutions like generative AI in healthcare, but there are already great algorithms that are used by leaders like Mayo Clinic. Recently, I found out that Mayo Clinic is using around 200 AI algorithms, very simple ones, and they are just helping, for example, to setting up alarms when something is going wrong with a patient. So the people or staff in the kind of command center, they had a feedback directly. So this is something that maybe we should go this direction. Of course, this customer focused solutions like personalized prevention, personalized advice, how to eat, how to move, when to do sport, how to sleep. This is also something that I think will contribute to healthcare system, not in the future, but already is contributing. A lot of startups working on solutions just for a consumer usage.
You reminded me, when we talk about personal health, one of the questions that I still have around digital therapeutics is how successful digital therapeutics for mental health are. I know they're supposed to be an add-on therapy to existing therapies. But do you have any insights in terms of the actual usability or feedback from clinicians that have prescribed DIGAs and why they prescribe them, how they learned about them? Because we often say that people in digital health know what the digital therapeutics are, but most clinicians won't really.
Mhm. I don't think it's true because recently I was visiting my doctor and I asked her if she knows what is DIGA, what are digital therapeutics. And she told me, yeah, of course I know. I have even some leaflets of some DIGA, so I can prescribe you one if you want it. I had this possibility to try one of the DIGAs within a pilot project. And it was very interesting opportunity and also experience because I had an app that was kind of giving me advice on how to sleep and to improve sleep, even if I don't have problems with sleeping. But still, this 1 month program and being coached by someone, by kind of digital coach, was kind of ear-opening experience. And I realized, well, it could work really. But the thing is that we still have to learn how to use this kind of solutions because we've been learned so many years that it's enough to take a pill and everything will be better. But we haven't been learned how to improve our behavior to get better. Yeah. What I can do personally to get better. And this approach is, I think, very damaging in the long term. And I hope that we will start teaching at school also how to take care of ourselves. And this will also lead to this digital maturity or digital literacy among citizens, that they will know, okay, maybe the pill isn't perfect, so I will take the TX. So yeah, there have been a few articles in the press that the doctors really don't know what is DIGA. It was something like 50% of doctors don't know what are digital therapeutics. I'm not surprised because it's the beginning, how long the digital therapeutics and DIGAs are on the market, only a few years. So it will still take a few years that everybody knows what it is, also the citizens and the patients.
I agree that we're still in very, very early stages of that. I said 3 books. We started with one. What are the other 2?
Wow, you surprised me. Well, okay, 3. The first was Great Kurzweil. The second one that I read 2 months ago is the book called Intelligence, Living and Working with AI, written by Wharton professor Ethan Mollick, if I'm right. Yeah, Ethan Mollick. So unlike Mollick is quite optimistic about AI developments, and he sees AI as just another tool for the advantage of humans. So, and he encourages experimentation with generative AI to stay, abreast of progress. So he's a professor of AI. So I trust him probably more than I trust Ray Kurzweil, who was working for Google. And basically he was also promoting a lot in his book, all the solutions, AI solutions made by Google. But Professor Mollick, he is very down to earth when it comes to AI. So what particularly resonated with me was his view on AI in healthcare. There's not much about AI in healthcare in his book, but according to Mollick, AI is not able to, for example, replace any healthcare worker, but can take over some tasks. And it's very realistic view because healthcare is a system with a lot of these internal relationships in which doctors and nurses have roles beyond only medicine. Yeah. And it's interesting how all these relationships are working and how it's hard, even if, let's imagine that there is AI that can already replace a doctor or a nurse. So even if it's possible, we won't make it because all the relationships in the healthcare complex system, they won't make it even possible. So if you have some time, I really recommend this book by Professor Mollick. it's a great dive into the AI from the very realistic point of view.
Mm-hmm. Yeah, as I mentioned earlier, we still have a lot of data issues that need to be solved before large-scale AI applications. One that I find most intriguing is the use of billing codes for prediction models. I know that there's an Israeli company that's already doing that. So if you've got two patients and just take their billing history, you can potentially predict what kind of complication one person could have based on the same pool of patients with similar problems. So using that and tailoring preventative measures based on that information is one of the things that I find in a way scary, you know, from the personal point of view that somebody predicts what's the next disease that you might have. But at the same time, it could have a huge impact on the efficiency of healthcare systems.
Yeah, we still have to think about what to do with this kind of data, to know in advance that you will have this disease or another one. Do I want to know it or rather not? So I guess it will be possible in the future, of course, but it will be also my freedom to decide if I want to know and a freedom not to know, basically. And there are some scary solutions. Recently, I've been writing an article about, for example, operation room black boxes. So black boxes like in the airplane that are recording everything that is happening during the surgery. On the one hand, it's fantastic because after the surgery, you can analyze step by step what is happening at the operation room. And you can find out, okay, we did this mistake and we should avoid it next time. On the other hand, of course, it's like a big brother for surgeons, so for doctors working at the operation room, because the big brother is watching their hands. And when something goes wrong, we can analyze it step by step, pixel by pixel. So it's also scary, but I think it has also a big potential in the future.
Mm-hmm. Yeah, for the improvement of the work of individual practitioners and professional development. You go to a lot of conferences. Does anything stand out to you in terms of what you heard recently in 2024? You were at HIMSS Europe, you were at Bits and Pretzels and many other conferences. When you started talking about the potentials and surveillance, I remembered the session at HIMSS Europe 2024 around the usability of VR, where they used it for simulating a plane crash. There's a game that you can still play online and remember all the safety instructions that we always get when we sit on planes. Those that flew more than 3 times probably don't listen to instructions anymore when, you hear them before takeoff. But through VR, they show that actually people remembered much better. The information really stuck with them in terms of what the right way of acting is if a plane crash happens. So what did you hear at conferences in 2024 that gave you most food for thought, or you thought was really insightful, not just something that we keep hearing about?
Well, I keep hearing about AI, of course, all the time, as I said before. Also at the HIMSS conference, there were a few sessions on AI, but I would say it wasn't an overhyped topic during the HIMSS conference. So there was a fantastic session on AI leadership with Chris Ross from Mayo Clinic and some other representatives of leading hospitals in Europe, in Israel, and also in France. And I learned a lot of how to implement AI in healthcare. What is a topic number one from my perspective? Just leaving behind AI, well, a little bit, leaving behind EU AI Act and EHDS, that was also the main topic of the HIMSS conference, are so-called ambient intelligence systems. EHR, electronic health records, it's the pain point of healthcare right now. So I'm so fascinated by the use of this ambient intelligence that automatically create electronic health records. This is something, quite new. And I have seen it recently at one of the conferences. I've seen how these computers are just creating electronic health records by listening to the conversation between a doctor and a patient. This is so fascinating because doctors have been typing in all the data for years. And finally, they can free up their hands and they can talk to the patient. And computer is doing that, what they've been doing for years. So I think this is something that has enormous potential. Again, we have to think about this, how to convince a patient, but there are already studies where the patient said, yeah, we are convinced this is working, and I'm really happy that my doctor finally can talk with me, can take time to talk to me, not just looking at the computer and just typing in. So there are few first studies that are showing the advantages of such a system. So I think this is something that is coming, and with the generative AI, the progress in ambient intelligence will be quite huge in the next years. So yeah, I hope that finally, after this years of doctors really hating EHR, we will have something will make EHR great again.
Yeah, it's good also for patients if they get a copy of the conversation, because studies have shown that when you're talking to a doctor, I don't know what the right percentage is it 60 or 80%, but the majority of things that the doctor says you won't remember, just because it's an emotional situation, it's a very specific situation. And one thing that we often forget, I guess, as patients, is how well prepared it's worth going to the doctors. And I really liked the book from a behavioral specialist from Israel. So she wrote this book called Your Life Depends on It. And the gist of the book is that whenever you go to your doctor, remember these three questions. What are the risks? What are the benefits? And what are the alternatives of anything that's suggested to you? And just through that, you can increase the amount of information that you get and increase the thinking around. And speaking of books, what's your number 3? I can't believe we are basically centering this whole discussions around the 3 books. I thought it was going to be the first question and then we're just going to steer to other places, but it's good like this too.
Yeah, but you see that I'm reading books about AI all the time, so I promise that the third book won't be about AI.
Okay, so what is it about?
Yeah, so the third book that I'm reading right now is Superforecasting, the art and science of prediction. So no medicine, no healthcare, just prediction and future. This is a book about how to predict the future using various techniques. Yeah. However, it's not about fortune telling. It's about tapping into historical information or analyzing the opinions of various experts to create some kind of scenarios of the future. Even if it's not about healthcare, this book is also useful for people working in healthcare, because it teaches how to anticipate the development of, for example, new technologies in healthcare and even AI. So yeah, after reading this book, I really started to doubt even whether Ray Kurzweil, the author of the book Singularity is Near, is a good forecaster, or if his forecasts are coming from, kind of tip of the nose, as the authors described it, this phenomenon, this ego-focused approach. So yeah, this is the third book. If you are already asking about books, I will add 2 ones that I'm going to read this summer. I would also recommend. The first one is a new book by Frederick Ferd. He's a Google's first chief information evangelist. And the title is What's Next is Now, How to Live Future. And the second book that I've just ordered on Amazon is a brief history of intelligence, why the evolution of the brain holds the key to the future of AI. I hope this book will enable me to understand how human intelligence is working and how AI in the future could be built to mimic this human intelligence, and if it's possible anyway.
So a lot about predictions and a lot about AI.
I don't know why. Maybe it's about summer and this break where I have more time to deep dive into topics and just to write about things that I would like to write about. And I don't have to rush from one conference to another one. You know it very well.
Yeah, but it's also a good strategy because, as you mentioned in the beginning, technology is developing very, very rapidly. And if we want to write about it, we also need to understand it.
Yeah.
And that's one of the huge challenges in healthcare. How can you upskill the workforce that's already incredibly burdened, and the need for experts that have the technical and clinical knowledge is increasing, and that's really challenging because basically two very heavy subjects need to converge in one person.
Yeah, exactly. You know, at the HIMSS conference during the session AI Leadership, I remember Chris Ross from Mayo Clinic said that there is no way to implement any AI algorithm, any new tool that is not integrated into electronic health record, because doctors are already overburdened and they don't want another application, another system, another screen. Even one click more is too much. So it's a very healthy approach to technology. I think it's a new approach to technology because before we were so fascinated about all these possibilities, all these applications, and we have all the startups developing great tools and promising you don't have to worry about clicking more because it will help you in your work. But at the end of the day, the doctor, the nurse, they have to use it and they have to click it through or open another window. No new tools, just everything integrated into electronic health record.
Yeah, a dream come true for many healthcare professionals.
Hopefully.
One last question. As someone observing health tech very closely, what are you most hopeful about and what worries you most in terms of trends?
I have a lot of hopes, high hopes, because there are so many unsolved problems in healthcare. The first one I mentioned already, this is so-called ambient intelligence that would help to create the electronic health record and to gather data from patients. This is the biggest hope for me, that finally we will solve this problem of electronic health record and doctors will have more time for patients. Where another hope is that we can do a lot for patients and for citizens. We are at the early stage of the development and we are experimenting with how we can implement AI in prevention, for example. And I hope that in the future we will be able to connect all the data points from different data silos and all the behavioral data, all the medical data, all the data from wearables to find out some kind of tracks and to find out wrong with the patients in advance or how we could really prevent some diseases. This is not new, yeah. But this is something that, I hope that the doctor of the future won't be doctor working basically in the hospital, but doctor that will be kind of health architect or something like this. So yeah, this is my big hope. I don't know if it's down to earth. As for concerns, I'm afraid that, for example, data protection issues or the interest of individual groups will inhibit potential positive changes in healthcare. Because we've been talking about all these, technologies and all these advances. It's great. But for years, I have kind of impression that data protection is simply an excuse in healthcare, which is stuck in archaic structure. I often say that in healthcare, we are basically dealing with so-called theater of innovation, not innovation, but theater of innovation. Everyone wants to change, but too many groups are beneficiaries of the current inefficient health systems. That's why resistance to digital transformation is so strong, even if we can't see it, but it's there. So don't ask me what to do with that to change it, but I'm afraid that this data protection thing will just hamper all the innovation that we have, and we will continue doing what we've been doing for years. So this is something that I'm really worried about.
Yeah, progress is slow in that regard. But you just got me thinking, because when I was thinking about this question, I didn't consider what my answers would be. And
So what is your
thinking,
answer?
I think my biggest fear would be that we start relying on health tech too much, and that I'm on the operating table while the doctor is using an XR headset to basically manage the operation, and the hospital is under a cyber attack. So that system gets hacked.
Security is key for the future of health.
Yes, I think it's getting increasingly complicated, and as hospitals are digitizing, it's becoming more and more crucial for systems to be protected. And the thing about cybersecurity is that the less user-friendly the system is, the more secure it is. As soon as we try to make it more user-friendly with access cards, etc., it's more vulnerable. So that's on the fear side.
And on the hope side, I'm in the role of the journalist, and I will be asking questions.
Actual usable predictions or advice based on patient data. So, for example, I'm tracking my sleep through the Apple Watch, and I tested a ring which gave you scores, but it wasn't really useful because I got this great sleeping score one day. You might say you should do exactly what you did that night, so your sleep is going to be this good. The problem is that the reason my sleep was great that one night was that I have a 5-year-old and he was staying with his grandparents on that night. So the solution isn't for me to, offload my kids to someone else so I'll sleep good. So I think we still have a lot of work to do in the recommendations for behavioral change and all the factors that are impacting our health. But the thing that I mentioned before around improving and optimizing care through better preventative actions based on billing data or some other clinical data, I think that has huge potential. So we don't have one size fits all screening programs today, which are still very useful, but we could probably do a lot on the optimization side of those. So that's that.
Yeah, that's funny what you said about this scoring system, because I had a similar situation, and then I realized that even the best AI can't still understand the context of the situation. And the context of the situation is very important. I recently had an interview with an expert on robotics, and she told me, well, imagine that there is an interview for a new job position and you are very nervous, but you still try to smile and you still try to look very relaxed. So the AI system would say, well, he's relaxed, he's smiling, he's doing very well. But people sitting on the other side of the table, they would say, okay, he's pretending to be so relaxed because we know how he feels at this situation. So the story about scoring systems while sleeping, when I had a COVID-19 a few years ago for the first time, the first night was really a nightmare because I tried to sleep, but I couldn't. So I decided, well, let's not move and maybe I will fall asleep. And I didn't sleep at all that night. But in the morning, my smartwatch told me, you slept very well, 8 hours, just because I was trying not to move that night. And, my smartwatch interpretation was like, okay, not moving, it means sleeping very well.
Still a lot to do in that department. Yeah. So we'll continue the discussion, I'm sure, at another opportunity, at another conference where we will meet in person. But for today, Artur, thank you so much for your time and the insights that you share. And do keep writing about the books that you read on your LinkedIn profile. It's really useful for others that maybe haven't picked them up to get some sneak peek into that content.
Thank you very much. Thank you for having me. And please keep doing your podcast because it's also great source of insights and information on what is happening on the market.